Hello everyone and welcome back. We are continuing with the clinical communication criteria of OET Speaking. We've been looking at relationship building, and today we'll be looking at an integral and important part of relationship building, which is empathy. But before that, let's quickly recap what we had discussed earlier. So we were looking at how relationship building is important for patient-centered care. So we have already covered the aspects which make it really important. And can you recollect the 4 indicators of relationship building, which we had already discussed last week? Please type in if you are able to recollect. Great. So the first indicator was initiating the interaction appropriately, or having a warm start to your interaction. Okay, and moving on, the second one was about being attentive and respectful, and we learned how important that is to build trust in the patient care setting. We also looked at what it means to be non-judgmental. If you remember, we had a lot of discussion and activities based on developing your ability to be non-judgmental in a clinical setting. And the last indicator is about showing empathy. Right. So last week we discussed that non-judgmental approach. Today we are looking at empathy and how to build empathy and how to communicate empathy in your OET speaking and also in a clinical setting. And remember, these 2 indicators are closely linked and they complement each other, so you can't sometimes differentiate, or there is a fine line between them, and there is some overlapping, which is absolutely fine. So let's learn to look at in totality in a comprehensive manner, where you don't have to really distinguish every time separately, but let it just flow into each other. So here on the screen there's a beautiful word cloud of empathy. Now, if you can think of some other aspects of empathy, please type in. So you have therapeutic adherence, understanding, doctor satisfaction, nurse satisfaction, perspective, diagnostic accuracy, emotions, patient satisfaction, clinical encounter, a lot of words which are all closely linked and which is really helpful in your developing of empathy. All right, so we are going to look at empathy a little bit closely and try to understand what empathy is all about. A lot of candidates talk about empathy, but they are not sure what it is. They may not be too sure how to create empathy or how to show empathy. And sometimes it gets confused. So we're going to clear that clutter and let's bring in some clarity on how you can show empathy in a very simple way. So empathy is fundamentally 3 things. Firstly, it's understanding the patient's situation, their perspective, feelings and thoughts. All right, so when you have a patient with you, or in the OET speaking subtest, when you have the interlocutor who will be doing the role of a patient or a carer, You have to understand what they're going through. What is their situation right now? Their feelings, their thoughts, their perspectives, right? Developing that understanding is fundamental, and that is the first stage of empathy. Now, the second step is developing an appreciation, a sensitive appreciation of that understanding. So when you have understood something, you need to appreciate that, value that in a very sensitive way. All right. So once you have understood this patient's situation, once you have developed a sensitive appreciation for that, the third step is communicating that understanding to the patient. So that means you're going to tell them that you have understood what they are going through. You value that situation with all its sensitivities, and you are conveying that. All right, so remember these three factors which create empathy. There are a lot of other factors as well, but this is fundamentally what empathy is all about. So now let's look at two routes or ways to show empathy. The first one is non-verbal communication. What is non-verbal communication? Non-verbal communication includes a lot of things. It includes silence and pause. It includes your body language. It includes the tone of your voice, gestures, facial expressions. So a lot of things. But from the context of OET speaking, silence and pause and tone of your voice are very, very important. Sometimes when the patient says something and you want to express empathy, a little bit of silence, a short pause will do wonders. It shows that you're attentive, it shows you are empathizing with them. And this is really important. And oftentimes, when you're in a test condition, you may be too quick. The patient says they have pain. You say, oh, you got pain? Okay. All right. So that has to be avoided. You really need to learn when to pause, when silence will be golden. And that's not a long silence, but a very quick pause. Right. Voice modulation, the tone of your voice carries a lot of empathy. So that's another tool which will help you. When you are expressing empathy, you can use things like, oh, I'm sorry, you are in pain. So your voice tone changes to suit the kind of empathy you are expressing. So these skills will be very helpful. So remember, non-verbal communication is something which is often overlooked, both in everyday situations and also in clinical settings. But this is really powerful. Make it a friend of yours. And the next one is verbal communication. So when you look at verbal communication, it's about, in the context of empathy, it's naming the patient's emotion. So if they are sad, you are bringing that emotion. You're talking it, including it in your communication. And it is, as we have already discussed, showing that sensitive appreciation, acknowledging it. So all of that uses verbal communication. You are using words to convey that. That's also equally powerful. So when you're able to bring both these together, the non-verbal communication and the verbal communication, to show empathy, you will be really good at showing it in expressing empathy. So that's one skill which you have to really focus on and build on, and that's going to be immensely helpful for you. I've got an example for you now. Watch this video snippet. Look for both. Look for nonverbal cues and also the verbal communication which this doctor uses when showing empathy to the patient here. Let's watch it.
Teenage children, they keep you busy.
Oh, they do, yes. I mean, it's like having a taxi service. You what with that and then at work, I'm so busy at work. It's just so tired.
Just if you're feeling tired, it must be hard for you to do all those things.
Yes, it's difficult. I just feel as though I can't cope anymore.
Great. I hope you have learned a lot from this example from the University of Nottingham. It's amazing, actually, and if you want, you can go back and revisit it and, acquire a lot of empathizing skills. We're now moving to a bit of practical application of empathy skills in your OET speaking. And to help you, I've got two patients. We're joined by Leroy and Christine. So let's look at what Leroy's problem is, and we're going to together frame an empathic response. So Leroy reports a terrible tummy ache since yesterday. A very common situation which you might encounter or could be similar to something you get for your speaking. So the first stage would be to identify the emotion. So what emotion is Leroy having right now? Can you give it a try? Yeah. So Leroy's emotion is feeling terrible. So once you've identified the emotion, what you have to do is identify the cause or the trigger or the reason behind that emotion. And for Leroy, it's the stomachache. Leroy's stomachache is the reason, is the cause of his feeling terrible. Now that you've identified the emotion and the cause, what you have to do is frame a response by showing that you have made the connection. So you're going to connect the emotion and the cause and respond accordingly. So can you try to type a response where you are bringing both together? Excellent. So here is a sample response for you. But remember, you can respond in other ways as well. You must be feeling terrible with the stomachache. So that's one way of responding to Leroy with empathy. Now we have got Christine. Christine was in pain and pressed the buzzer. No one attended her and she is visibly upset now. So can you identify Christine's emotion? There are two. Upset, angry, all those emotions. So as we are done with Leroy, you're now going to identify the cause of the emotion. What makes Christine upset and angry? Try to spot that. Here you are. So her triggers were number 1, being in pain, and number 2, being unattended, not being attended to. So now what do? We've got to respond, combining both. Great. So can you try it again? You did a great job with Leroy. Now I need a good response for Christine. All right. So here is a sample for you. I'm sorry that the nurse did not attend to you even after you pressed the buzzer. And I can imagine how upset you must be. Yeah. So remember, this is one fine way of showing empathy. You identify the cause, you identify the emotion and the cause, and then you respond, bringing together that understanding, combining both. Excellent. So now that you have learned how to show empathy, let's test it. Can you spot which of these responses has got empathy in it? That's right. Response B. So here, the health professional is telling the patient, let's see if I've this right before I examine you. You have had terrible headaches for a week now, and it gets worse at night. Is that correct? So that is a good response, which is showing empathy. So here comes the next one. B is the correct response, but even A looks very much full of empathy. The problem with response A is that it's too reassuring. Now, reassurance is a very good skill which you need. However, it's not ideal to replace empathy with reassurance. Now, for a lot of health professionals, reassurance comes automatically, and in fact, everything could be all right. However, for a patient, just listening to everything will be fine and you'll be okay, don't worry about it, is not so reassuring. An empathetic response would be more reassuring than mere words of reassurance when it's not the apt time for reassurance. All right, so don't get me wrong, reassurance is indeed important, but empathy is equally important. And in places where you have to be showing empathy, you should be showing empathy and not jumping to reassurance. And oftentimes that is a very automated response and might not come up with the outcomes which you may think it would. So that's something which you should be really cautious about. Okay, so let's move on to another one. So this is a scenario where the patient who has been on pills is now recommended to move on to injections. And it's very typical, let's say, for a patient who is starting on insulin injections or something like that. Yes, you're right. Response A is the one with empathy. Great. So today we have learned how to show empathy when you're responding to a patient. We have learned how to frame responses which are empathetic, including identifying the emotion, the cause, and responding, bringing both together, your understanding of empathy, how important understanding empathy is, having the sensitive appreciation, and your ability to communicate that. Now I want you to apply these in your everyday workplace situations and also in the OET's Speaking subtest. So that's it for today. I'll see you with more on clinical communication shortly. And if you need any assistance, do let us know. Thank you.